Hello, my name is Peter, here in the bottom left corner, and I'm going to present a project that resulted in the app that you can find if you go here. Okay, so the project is about stopping NHS Cancer Care underperforming. Okay, now NHS has actually consistently been ranked quite low according to some objective metrics internationally. It has a plan of improvement. For example, it wants to improve its own ranking on international cancer benchmark. And by 2028, it aims to diagnose 75% of all cancer at early stages. Of course, to achieve this, short patient waiting time is really a key. So, in fact, it is very surprising that presently there is no easy way for NHS providers and clinicians to view or in any way interact with cancer waiting times data. So basically, in this project, we would like to model the NHS cancer waiting times in order to help this situation. And we also would like to see if we can register some impact of the COVID-19 pandemic on the cancer waiting times. This is a collaboration with a faculty NHS team represented by Dom Dathan and Matt Ware. So regarding COVID, we can phenomenologically say that it has impacted waiting times for cancer patients due to patients oftentimes delaying their own GP visits because they were afraid of COVID, or cancer screenings being suspended due to COVID. And of course, there were NHS staff shortages. So the question is, can we quantify all these factors in any way? This is what we did. We looked exactly at that. So first of all, the model, briefly about the model. So it's a seasonal trend model that we built. What was our data? NHS publishes certain numbers. In fact, it publishes the three key routes of three key stages of a cancer patient and whether it was successful according to its own standard in processing the patient. The first one is a 14-day GP referral. This means that if a patient has cancer, he or she had to be referred within 14 days by a GP. Then within 31 days of a multidisciplinary team diagnosis, the treatment should start. And within 62 days of the initial GP referral, the treatment should definitely start. So these are the three key metrics. And for each one of them, there is a number of patients who went through this and the number who were processed successfully according to the standard. So this immediately suggests to use a Bayesian hierarchical model with a binomial likelihood representing the success of NHS in treating the patients. And what we wish to fit the probability of success here is some kind of growth function and some kind of periodic trends. The closest analogy would be a Facebook profit model. So on output, we want to get COVID agnostic prediction, i.e. what would happen if there was no COVID? Where would the NHS efficiency be? And of course, we want to do future projections. So all of this we've done and summarized in terms of an accessible dashboard app, which GPs can use for guidance on where to best send patients, which hospitals. A national care team, the NCT, can use this to identify UK regions and trusts who need intervention, and also NCT can prioritize specific hospitals. So the app is via this link. It's publicly available. Let me walk you through it a little bit. It will have some NHS jargon on it, okay? So first of all, one needs to select here a region of UK, starts with a national mean, then a provider, which means a hospital, and the date range. What it plots is the efficiency of NHS with a solid line, the data, with this dotted line, the COVID agnostic model prediction, and with a dashed future projections. So we see here on a national level, this is the national efficiency of NHS. We see that the model correctly captures kind of the local topology of the curve. It has a dip where the data has a dip, but it's significantly above. So this is where we would have been if there had been no COVID. Now, of course, one can play around with it and move around in time and always notice the COVID effects. Here we see that Southwest, for example, as a region, on average, has not been that affected by COVID with respect to patient waiting times. But east of England has been quite affected. This is what it would have been. The efficiency would be quite higher had there been no COVID. Finally, GPs can use it to compare individual hospitals to decide where to send the patients. Here are two hospitals from London. We see that Homerton, the red one, was barely impacted by pandemic, whereas Chelsea and Westminster was impacted quite a bit. The reality is here, whereas the projection of no COVID is significantly higher. So with this, I would like to close. Just a point about future steps. We would like to include some more data sets, such as chemo, radiotherapy, and diagnostic data. We would like to explore better uncertainty quantification within an alternative generative model with more expressive posterior distributions, such as conditional variation autoencoder. And finally, we would like to account for exogenous variables, example, population growth. Thank you very much for listening. Check out our app. It's right here at the bottom.